Well, kia ora koutou katoa. Welcome to the Ministry of Health. There are no new cases of COVID-19 to report in New Zealand today. That's no new cases either at the border or in the community. This result is particularly pleasing as it includes test results back from a number of the close contacts of the case we reported yesterday, including his one workplace contact and 2 of his 4 household contacts. The other 2 have been tested and we're awaiting results. We're continuing to investigate the source of this man's infection, and as I said yesterday, we have a clear line of investigation because the nature of his work meant that he was boarding ships that had travelled to New Zealand from other countries, and those ships also have international crew members. We believe the most likely source of the man's infection is a ship that he worked on in Auckland on the 12th and 13th of October, the Sofrana Seville, and we can give you the spelling of that afterwards if you need it. That ship had travelled from Brisbane to Tauranga and then on to Auckland, where 8 crew joined it from the Philippines on the 13th of October, and 4 of the crew that had been on board since March departed New Zealand at that time too. The case that we reported yesterday, as I said, had done some work on that ship while it was in Auckland and while wearing PPE on board, and we're just still getting further detail about his movements whilst on board the ship. The Sofrana Seville then travelled to Noumea, and it's now on its way to Brisbane. We're working closely with public health authorities in both those ports to follow up as appropriate and work with them according to their country's protocols and procedures. Obviously, we will be very interested to see if any of the crew members on board that ship now are either symptomatic and or have had any testing done. We also planned to test the New Zealand-based crew of another ship that the man worked on prior to working on that ship, so a few days earlier. We do not believe that ship is the source of the infection, as it only operates in New Zealand waters and it only has a New Zealand-based crew. But we do want to ensure that all avenues of the investigation are explored and ruled out. So, the ship that this engineer subsequently worked on, which was on Wednesday at the ports of Taranaki, the Ken Ray, is currently anchored off Napier, as I think you're aware. We are treating all 21 crew members on board that ship as close contacts, and everyone involved in the process of ensuring that the ship, has been extremely helpful in ensuring there's no risk posed to the community, and want to thank them for their cooperation as we work through our next steps. Crew members are receiving daily health checks via radio. Now, genome sequencing on the case we reported yesterday has been completed by ESR, and it fits with the scenario that this case is effectively a new border incursion, rather than being a community case of unknown origin. Results from the genome sequencing show that the strain of COVID-19 that this man has is not a type we have previously seen in New Zealand and is not linked to any of our existing New Zealand cases, and particularly reassuring is that it is not linked to the recent Auckland August outbreak. We have established pop-up testing at the port of Taranaki, and regular testing is available at the ports of Taranaki again this morning. That testing will be available in Auckland from Monday through Saturday this week, and all workers are also being given a voucher if they're not planning to be at work at the port this week, and they can go to a GP or a community testing centre. And staff who may have had interaction with the man when he visited or stayed at hotels in New Plymouth are also being tested, and they're not considered close contacts, but this is out of an abundance of precaution. So then moving on to our overall numbers, they stay at 1,530 confirmed cases. 5 additional previously reported cases are now considered to have recovered, and so our total number of active cases is 37. Yesterday our labs processed 1,773 tests for COVID-19, recalling that those were the tests that would have been taken on Saturday, which was election day. And that brings our number of tests completed to date to 1,031,888 exactly. So I'm now open to questions.
Is there a need to review how we manage our ports to better contain any potential spread?
Well, I think the measures we've got in our seaports are very good, and they do include regular testing of workers there, including and in particular regular testing of anyone who accesses the ships, whether it's pilots, stevedores for unloading cargo, and people like this fellow who had been tested several times already as part of that regular testing. Of course, we are going to look at the entire process that happens and look and see if there is anything that needs to be strengthened, and in particular anything we can learn from this case.
How regular is regular testing?
How regular is the testing? Well, this person was being tested fortnightly, and so that's, if you think about the incubation period of this virus, that is regular testing, and he had been tested 4 times previously prior to the test that was done because he was symptomatic on Friday.
Should he be tested weekly?
Sorry, what was it?
The risk profile, do you think he should have been tested weekly, or do you think fortnightly?
Well, at this point we think fortnightly. I think, again, we'll have a look at this because one of the things I talked about yesterday was the nature of his work involves him being on the ship for quite long periods of time. So, for example, in New Plymouth for a period of 6 hours. So whilst he's wearing PPE and the crew are wearing PPE, that the length of that exposure may mean that either more regular testing might be indicated, or testing that is associated with automatically with a period, maybe 2 or 3 days after he has worked on a ship. So that's one of the things we can look at.
How was the man only infectious?
Sorry, follow-up question here.
How was the man only infectious for 2 days?
Oh, that's just the period that we use. The 48 hours before symptom onset is considered the period when someone may have been asymptomatic but infectious, and so that's the period we look at any contacts they've had during that period of time.
Are you able to say how many tests have been done across everyone? Because obviously now the net is widening, so to speak, with the hotel, with the various ports. Do you have any ideas how many testing we carry out in relation to this one case now?
So in terms of close contacts, there are just 29. 21 of those are those on board the ship that's currently off Napier. The balance are his household contacts for their single workplace contact, and then there are 3 associated with the who have been treated as close contacts associated with the hotels that he stayed in New Plymouth. So far, all the testing has returned negative, and the only tests outstanding are just 2 of his household contacts. But all those people will remain in the full 14 days isolation and be retested.
Is everyone on the ship being tested? The one that's off Napier?
They haven't been tested yet because options have been looked at about whether to send a vessel or a helicopter out there and someone to test them there, or for the vessel to berth, or for the vessel potentially to go through to Auckland. Those discussions are happening. In the meantime, they're all effectively in quarantine on the ship and receiving daily symptom checks. No one is symptomatic.
Do you have a preferred option? Or what?
I don't have a preferred option. I'm leaving to the public health colleagues in Napier and Auckland who are working through that. Sorry.
We understand that the port doesn't want the ship to berth, so could that create some complications?
Well, that's my understanding as well, and that's why we're working with the ship, who's been extremely cooperative, and its agent to think about what the other options might be. And another option might be that they take the vessel through to Auckland, where the public health unit is bigger. The port may be willing to have the ship berth, and we can deal with it there. So we're just working through those options now.
Do you have a timeline for when you want all the people on that ship to be tested by?
Not particularly. The important thing is that they're symptom checked and that they're all effectively quarantined, which they are, and then the testing. Usually what we do is we try to test people ideally at 5 days prior to their first exposure to the person. So that's coming up about now, but it's reassuring that none are symptomatic at this point.
Have there been any conversations about limiting the number of international ports in New Zealand to kind of prevent any further?
Not at this point, but again, that's one of the things it's been talked about, and that's one of the possible things that could be done.
Do you know what the nature of his work was on the Napier ship, or how long he was there?
The ship that's off Napier now was the one he worked on in New Plymouth,
yeah.
And he spent 6 hours there. what I can on the ship. He'd travelled down from Auckland. He's a marine electronics engineer, so he was working on the bridge of that ship, is my understanding. So it would have been working on some of the equipment there, and there were other people on the bridge who were crew of the vessel during that period of time, on and off, that he was on the bridge.
What about the ship he was working on in Auckland?
I don't have any more detail about that at this point.
Do you think you could limit the amount of time these people are allowed to go on in one go? Would his work be able to, would he be able to do his job if he was limited to maybe 2 hours at a time, come off, change PPE, go back on?
Yeah. Look, I think these are the sorts of things we want to look at. Clearly we know that length of exposure, period of time, it does increase the risk if there is if someone is infected there, or if there is virus in the environment. But it's looking at things like the amount of time PPE use, whether there are other people in that same room while the technician is working there. So these are all things that we can look at in the protocol. Again, it's a matter of continually learning and updating the protocols.
Given that today you've said that it's a new strain that we previously haven't seen in New Zealand, how many strains have we seen in New Zealand in total, and how many do you estimate are there sort of worldwide?
I have to say I'm no expert on this, but I'll make a couple of comments. We've had dozens of different sub-variants of the virus here, but they fall into several sort of main groups. That's the first comment I would make. The second is there are many thousands of different subtypes around the world, but the global database is very heavily weighted towards the strains that high-income countries report. So in particular, the UK, Australia, the USA, European countries, and ourselves, we make our results available. So what we've seen here is this strain is not one, is a new one, in that it's not any of the ones we've had reported here in New Zealand previously. Now we're matching it to see if it matches a strain that's on that international database, but at the moment the suggestion is it doesn't. And so it's probably from a country that doesn't necessarily have either the capacity or the ability to report, to do whole genome sequencing routinely and report that to the global database.
So you mentioned that the Philippines had 8 people, I think you said?
Yes, so 8 crew came from the Philippines. So there are two things I think that two other lines of inquiry we're thinking about the ship we're following up that's now on its way to Brisbane. First of all, its circuit is generally between Brisbane, the Solomon Islands, Papua New Guinea, New Caledonia, and then New Zealand. So it's sort of in that area. It is the route that it applies. So that's a potential source of the infection of the crew that were already on board the ship. And then there are the 8 new crew who came into New Zealand and joined the ship on the 13th of October from the Philippines.
Was one of the intentions of the flights to Sydney to allow people who have a permit to travel on to another state in Australia?
Look, I don't actually know the detail here, but I do know there has been some issues for New Zealanders who had travelled to New South Wales, then joined connecting flights to other part of Australia. My sense is that is something that the Australian states are sorting out, and are they the only ones who can sort that out? But that wasn't something that New Zealand was involved in the decisions or the criteria for onward travel.
So is anything being done to tighten up issues of Kiwis attempting to travel beyond New South Wales?
It may be being done, but that will be being done by the Australian authorities. That's something outside our jurisdiction.
Are these kinds of issues putting the future of these Trans-Tasman flights in jeopardy, do you think?
I don't think they'll be putting them in jeopardy. I think what they're doing is confirming that there is a range of quite complex issues that need to be worked through, particularly if there are different arrangements for travel between New Zealand and individual states in Australia, and that's why they'll be working through those issues.
So did we go too early on the Trans-Tasman bubble then?
Well, just a reminder, this is not a Trans-Tasman bubble. It's a one-way bubble where Australia has agreed that New Zealanders can travel to 2 or 3 states in Australia, and of course it will inform any future decisions about potentially a bilateral and wider Trans-Tasman bubble.
If people begin to test positive on this ship off the coast of Napier, would they be moved to a quarantine facility on land, or is there a thought that they might be kept on the ship, assuming their health and it enables them to?
That's one of the things we want to work through, and of course we need to do that in conjunction with the owners and the crew of the ship as to what would be the best option. I think one of the challenges would be if they were being quarantined on the ship, as we have seen early in this pandemic with cruise ships, is the nature of the quite close and confined quarters on board ships means it can be quite difficult to keep crew members isolated from each other. But that's something we would work through with the ship if it became an issue, to do what was best for assuring that and protecting the health of all the crew members on board the ship.
Is there a concern that the longer the ship sits here, and while trying to sort out this testing issue and so on, that it might turn into a situation like it happened on those cruise ships in terms of COVID sort of running freely?
Certainly that's one of the considerations. I imagine that given the situation we are in, and they are all considered close contacts, that the ship's crew will be taking precautions to remain isolated from each other as much as possible while that is worked through. And again, we'll work that through with them and try and avoid, if there is anyone who is infectious on there, actually that infection passing through to other crew members.
So is there some urgency here towards sorting out those issues so the testing can begin and the possible route for moving people onto land can begin?
Yes, although there is urgency. I think I know the teams, both the port authorities, our border authorities, our public health teams, both in Napier and in Auckland, are working on this with the ship's crew and their agents who are overseas and owners who are overseas.
So did the ministry want the ship to be berthed in Napier and in the Port of Jews, or is there a standard?
No, we didn't have a strong preference, but we had the opportunity, because the ship was en route to Napier, to notify while it was en route, and then a little bit of time for them to anchor offshore and work out what's going to be the best solution with all the parties.
Right. So there's no frustration on your part to try and get those people tested, and you're happy for them to be there while the situation is resolved?
Yes, I think because it's a very contained situation, and whilst there is some risk and they are all considered close contacts, our hope is that because both the worker, who was not symptomatic at the time, and the crew were wearing PPE, our hope is the best scenario would be that none of them have become infected.
Do you know if any of them have had any symptoms?
None of them have had symptoms, and they're having daily symptom checks.
The people from the Philippines, do you know if they quarantined before they boarded the boat, or did they just arrive and get on the boat?
Yes, there were 8 of them. 5 of them spent 2 days in managed isolation facility in Auckland while they were waiting to transfer to the boat in the port at Auckland, and the other 3 spent 4 days in managed isolation. Now, with these crew in transit, we don't routinely test them, and that's something we're looking at immediately today with Maritime New Zealand and Transport. Colleagues will be looking at that over the next few days. The Minister's asked us to do that, to see actually whether, even if it's for a short period, that we should test them to both see if they are infectious and therefore see if they're ready to join the ship, but also if we get a situation like this, of course, if they've been tested and we get someone infected, then we have a record of the test and we can have the genome sequencing, so it helps us with identifying the source of an outbreak. So we're looking into that.
Is 2 or 4 days isolation really enough?
So this is not so much intended to be isolation, but it is just they go into a managed isolation facility while they're in transit and waiting to be transferred to the ship. And that process is very carefully managed, so they're all transferred in a dedicated van, wearing PPE and onto the ship.
So did they board the ship in Auckland?
There is one more question.
Just back to the Australia issue, sorry. There seems to have just been a lot of confusion around this and what was and wasn't allowed. Are you concerned about the message this sends to Kiwi travellers wanting to head over to Australia?
I'm not concerned about it, but I think what it does show is, again, there's a new arrangement here. It's bedding in, and it seems to me that there's some work to do, and that is being done between the States and Australia to work out just what to do if New Zealanders travel there to a state that is accepting the flights and then wish to travel on to another state. But my reading of it is that these matters are being sorted out, and once they're sorted out, things will be nice and clear for any other New Zealanders wanting to travel there.
Has the Ministry of Health been in conversation with Australian officials about it?
We haven't been asked for advice on that specifically at this point. The question was in Auckland.
Yes, so they were moved from an isolation facility in Auckland.
Correct.
To the ship in Auckland.
Yes, the crew that came in from the Philippines all stayed at the Novotel in Auckland, and then so they were transferred from the airport to managed isolation through the usual procedures, and then in a dedicated van to join the ship on the morning of the 13th.
And then this person went onto the ship to do the work, whatever he needed to do?
My understanding is the person was working on the ship on that day and also on the day prior as well.
Just to be absolutely clear, did any of these ship workers, putting aside the community case, but the internationals, did they at any point come off that ship other than before when they're in the MIQ to get onto the ship? Did they go in any of the ports outside? Did they get any kind of leave, so to speak? Were they in New Zealand, so other than just being at the port?
No, they hadn't left the ship other than for this crew replacement that happened in Auckland. So the only two ports they visited were Tauranga, which was the first port of call, and then Auckland, and it was at Auckland that the crew transfer happened. 8 joined and 4 left the ship and went into a managed isolation facility for 2 or 3 days before their connecting flight took them back off to the Philippines.
Do any of these international crews get shore leave at the moment?
My understanding is they don't, but I will check that.
Thank you.
For the Kiwis that are in Melbourne, is the Ministry of Health concerned about the potential for more cases in managed isolation here, / when they return?
I think the risk is low. My reading of the figures in Melbourne is in the last few days they've had very low numbers of cases, and off the back of that they're planning to loosen up some of their current restrictions on movement. So I think the risk of Kiwis travelling to Australia, as you've pointed out, when they come back they still have to do 14 days managed isolation. But I would still consider Australia, including Melbourne and Victoria now, as to be low risk of the likelihood that they will pick up COVID-19. Any final questions?
Is there any update on the condition of the community case? Has he got, is he as well as can be?
I don't have a specific update on his condition, but I can say he's well enough to be being looked after at the quarantine facility in Auckland, so he hasn't required any hospital care.
Do we know if he moved, on his travel from New Plymouth back up to Auckland, did he stop off anywhere? Do we know that yet?
My understanding is he may have stopped for petrol, but as you will well know, most petrol now is self-serve, and but any stopovers are being investigated, and of course all the service stations have CCTV footage, and that is routinely considered as part of the investigation too.
How many workers were?
You may have mentioned this earlier, but the ship that's now on the way to Brisbane, where did it stop directly before New Zealand? Do you know?
Yes, it had come from the Solomons and Papua New Guinea before it visited New Zealand.
Do you know how many workers are on that ship?
The crew is 20, I was going to say 23 or 29, but we'll get you that number. It's a small number.
And you are expecting them to be tested when they get to Brisbane? Or are you
Well, we'll be working. That will be up to our Brisbane colleagues, but I imagine they would be very keen to rule out that there's any infection on board that ship, and to help us with our investigation.
How far away from Brisbane are they? I
don't know exactly, but I think within the next day or two. Yep. Thank you very much. Appreciate your attendance today. Cheers.
Thank you.
Great article. Thank you. I learned a lot.